Hello, and welcome to this bonus episode of Rare on Air, the monthly podcast by EURORDIS, Rare Diseases Europe. I am your host, Julian Poulan, and in our new quarterly bonus episodes, we are going to be exploring the work of European Reference Networks, also referred to as ERNs for short. These are the networks that connect clinical experts across Europe's borders so that their expertise can travel across borders to where rare disease patients reside. We covered the history and work of ERNs back in November in the first episode of our Rare on Air podcast series. Today, my colleague Inés Hernando talks to two people who serve as patient advocates within ERNs. They talk about what motivates their advocacy, what shapes their relationships with clinicians within the ERNs, and their advice for other patient advocates who are considering getting involved in the networks. Without further ado, I will now hand over to my colleague Inés.
I'm Inés Hernando, and today we'll be talking about the role of patient representatives in the European Reference Networks. And to do so, we have invited two very special guests who have been involved as patient representatives in these networks almost from day one when they were launched back in 2017. Graham, Slater, and Barea, welcome and thanks for joining us.
Thank you, Inés.
Thank you.
So let's get started. First of all, Maria, could you please explain to us why and how you were personally first got into rare disease advocacy? What's your story?
Well, my story is that my son was diagnosed with a rare disease when he was small. Since then, we joined a patient organization here in Belgium that is called VASCAPA. And then at some point in 2017, when the ERNs got established, then Professor Laurence Bon and Professor Mika Vikula invited VASCAPA to be part of VASCERN. And then it was a bit by chance because I was speaking English and I was available. Then I was selected within the team to join the effort. And since then, it has been a transformation for me.
That's amazing. Thank you, Maria. And Graham, could you now maybe share your story, your own story?
Yeah, well, my personal story is that I'm one of the oldest survivors of esophageal atresia, and although I've been very fortunate not to have suffered some of the lifelong consequences of that condition, nonetheless, about 15 years ago, I decided to try and get a little bit involved with the national support group for that condition in the UK, and I very quickly became a member of its board, and very quickly after that, I was instrumental in forming an international federation of esophageal atresia support groups around the world. So that's how I got involved, and that's what's led me to my engagement with the ERNs.
So let me continue with that thought, Graham. So you were one of the first patient advocates to be involved with the ERNs, and in ERNICA, in your case. Could you explain to us in a nutshell, what is the role of patient representatives in the networks?
I think the most important thing to say is that the patient's representation inside the networks brings the patient perspective to the work of the networks. And as a patient representative, you have to be mindful of the needs of the community that you're representing, and you have to be prepared to communicate also in the other direction to your community what is going on and why it's going on, and so on. And I think it's all about the real life experiences of patients. It's expertise by experience. And there are some very, very specific things that we are able to do within the work as well. And I think it's important to say that by way as example, we've been able in ERNICA, in the ERN I'm working in, we've very much able to influence some of the work which is done, but more importantly, contribute to that work. And one very specific example would be the work that we've done to bring the results of the projects and the studies which are undertaken inside the network to the community by the provision of animations and patient-friendly versions of documentation such as guidelines.
Okay, thank you, Graham. Thanks for that. So definitely it's not an easy role. Maria, in your case, I understand that the clinicians with whom you work in the ERNs, you were already very familiar, very close to them, let's say, before taking on your role as a patient advocate, because these clinicians were part of your son's care team. So I suppose that when you became a representative for your community, as opposed to a mom, let's say, that meant that you needed to reshape the relationship with the clinicians. So could you explain to us how this happened, and how did you manage to kind of shift the mindset and your relationship with them?
Yes, indeed, the doctor that follows the care of my son is indeed one of my primary contacts in the ERN, Professor Lawrence Bond. And I think it helped the fact that we were kind of working together already in Vascapa, because Professor Bond and Professor Vicula have remained very active in Vascapa over the years. They are at the origin of the patient organization. They are also very human. So they understood the need of patients in order to have a patient organization. They fostered the creation, they helped the creation, they are at the origin of the association. And then when we joined also, we understood since the beginning in the patient organization that it was also kind of a working relationship. It is not a supporting relationship at a patient organization level. But indeed, when it transferred into the ERN, I think that it was clear for the three of us that it was a working environment. At the end, the objective of the ERN is bigger than just for one person, is for all European patients. So having that clear in your mind helps the transition. I guess that we were all used to work, in working environments. So we immediately made a shift.
That is really interesting. In your case, Graham, did you have any existing long-term professional relationship with the clinicians in Ernica? Was there any specifically or especially challenging about becoming a patient advocate in the early days?
Yes, I did. I did have a working relationship with quite a number of the clinicians that are involved in Ernica. In particular, I knew the coordinator quite well. And that helps. I think everything about that is probably positive. But we have to remember there's a couple of things, I think, and this is where the challenges arise. One is that inevitably you find that the community you're representing gets bigger. I came from an esophageal atresia support group background, working in a work stream which covers other esophageal diseases, and so there was a need to broaden our representation and also to become more familiar with some of the other clinicians. But for me personally, that became a slightly bigger challenge when I was asked almost at the very beginning of the network to be the lead ePAG within Ernica. And what that meant was that I had to quickly understand, of course, the requirements of all of my ePAG colleagues and represent in the coordination team and so on, but to develop relationship, at least not in detail in terms of the work, but to develop a relationship with more clinicians. And I guess all I can say is that whilst on the one hand, yes, there's a challenge there, the fact that I'd managed to build that relationship in the past with the coordinator and so on probably helped along the way.
Thank you for that, Graham. Yeah, it's clear that so much of what you do is really based on trust and the quality and integrity of the relationships that you build. So I would like to finish this conversation by posing the same question to both of you. Do you have any advice for someone who's thinking to become a patient advocate in the ERNs? Maria, what would you say?
I would say yes, go ahead, please. We need more people. We need people that are involved, that understand, as said, that this is an European mission. Be ready because there are frustrations in the way, but there are great achievements. There are great interactions that are going to make you grow as person, but especially as patient representative. You would be able to help others in different ways that you have been doing it before.
Graham, anything you want to say?
Yeah, I think first of all, I would, I'd agree that it's, we want to encourage people to be ePAGs. We do need more. What I would say is the following. Firstly, it's important not to underestimate the commitment that this means. It is quite a big commitment, and I have to say, though, a very worthwhile and valuable role that we provide in the ERNs. I think it's also important to remind people who are thinking of becoming an ePAG that they do need to be confident about the community they're representing and know that they have a good network within that community, so that they are genuinely kind of representing the needs of that network and of that community, and they're able to disseminate information back. And then I think the final point I'd make is that although we use the word advocacy inside the terminology ePAG, this work is really more than pure advocacy. This is about collaboration. This is about co-building. It's about developing solutions with clinicians, developing care pathways and guidelines and so on. And this is fantastic, but it is new, and it can be quite a change from the kind of roles which patient representatives are typically carried out in their national associations or indeed in the international federations that they're members of. So that would be my kind of thoughts for them.
Brilliant. So thank you both. Thank you, Maria. Thank you, Graham, for this insightful conversation into the reality of being an ePAG advocate. So to our listeners, if any of you is thinking about becoming an ePAG advocate or applying to volunteer to work in any of the ERNs, you can find more information about the role and the mission of these patient representatives in the EURORDIS website. There is specifically a section that's specifically dedicated to ePAGs. And in that section, if you go to the mission and role tab, you can find a little bit more information about the role, the mission, and what is required to become a patient representative in the ERNs. Thank you all for listening to the first episode of ERNs on Air. This is our new bonus series of Rare on Air. Keep an eye for the next episode. And in the meantime, you can enjoy, of course, our regularly scheduled catalog of monthly episodes.
You have been listening to Rare on Air, a EURORDIS Rare Diseases Europe podcast with me, Julian Poulan. Thank you for joining us. Don't forget to subscribe so you can tune in next month to learn more about the world of rare diseases. Do you have any reflections from today's episode that you would like to share? Feel free to email us at rareonair@eurordis.org. We look forward to you joining us next month.